Every single person watching this has felt pain, and a lot of you are dealing with some version of it right now. But here's the problem. Most people, including me, for the first few years of my career, don't actually understand what pain is. We tend to think of it like this. You damage something, a signal travels to your brains, and you feel pain based on how bad the damage is. Some people say pain is not a measure of damage. Brain deciding that you need protection. And by understanding how it actually works, changes everything. How you deal with it, why it lingers, and why sometimes it doesn't behave the way you expect. Today I'm going to break down the main types of pain, what's actually causing them, and what that means for you. So let's start with the most common type. This is nociceptive pain. Basically, pain coming from your tissues. Your body has special sensors called nociceptors. Think of them like alarm detectors. They react to things like too much pressure, heat, chemical changes. So imagine you twist your ankle. Those sensors in the ligaments detect something's wrong. They send a signal up to your brain. Your brain looks at the signal, checks the situation, and decides protect this area. And you feel pain. That's pain doing its job properly. So there are two types of nociceptive pain. So one is somatic pain, the most common one. This comes from muscles, joints, bones, and skin. And it's usually easy to pinpoint. Example like sprained knee, muscle strain, stepping on something sharp. There's another one called visceral pain, which is coming from the organs. So this one is different. And it's harder to pinpoint, it's more vague, sometimes felt somewhere else. For example, a heart issue can cause pain in your arm. That's because the signals overlap in the nervous systems, and the brain gets a bit confused about where it's coming from. So the key takeaway is, for most people I see as physio, we are dealing with somatic nociceptive pain. And it's something that it behaves in a very predictable ways, and as the tissue heals, the pain reduces. It responds well to load management, gradual rehab, and with the right amount of rest. Now let's talk about a very different type of pain, neuropathic pain. This isn't coming from a muscle or joint, this is coming from the nerve itself. The system that carries the signal is the problem. So what does it feel like? So a lot of people will describe it in a very similar ways, like burning pain, shooting pain, electrical, tingling, pins and needles. You might also get extreme sensitivity or pain from things that shouldn't hurt, like light touch. So the common examples are sciatica, carpal tunnel syndromes, diabetic nerve pain, or nerve irritation after injury or surgery. So the reason why it's tricky is because neuropathic pain is harder to treat. It doesn't behave like normal tissue pain. You need more than just normal painkiller, and it can last a bit longer. And what we do as physio, we focus on gentle nerve movement or mobilizations, and gradual loading, and education, which is very important, because once people understand why it feels strange, they stop fighting it in the wrong way. So the important thing is the nerve heals slowly, and roughly 1 millimeter a day. So recovery is usually 6 weeks to months or even years. This is a big one. The one that explains a huge amount of long-term pain. So what is this? There's no tissue damage, there's no nerve damage. The issue is in the processing system, your nervous system itself. So simple way of thinking about it is, imagine your car alarm. Normally, it goes off when someone breaks in, but now it goes off when the wind blows, a truck drives past, someone walks nearby. Nothing is actually wrong with the car, but the alarm is just too sensitive. That's nociplastic pain. So what you probably see is the pain doesn't match the scan, or the pain that spreads or moves around, pain that sticks around long after healing, or pain affected by stress, sleeps, or mood. You might also feel more sensitive to pressure or temperature, such as fibromyalgia, chronic lower back pain, or any long-term unresolved injuries. If you use a similar approach by treating this like a normal injury, often make it worse, because you keep pushing, loading, and forcing it. You are feeding a system that's already overloaded. Sometimes it's helping by understanding pain, gradually exposed to movement, calming down the system, better sleep, and managing the stress level. Sometimes psychological support helps too. So refer pain is pain in one place, but the problem is somewhere else. Examples like back issues, but the pain is down your leg, hip issue, the pain is down your knee, or if you've got neck issues, the pain is down your shoulder. So if you treat where it hurts, but not where it's coming from, nothing changes. Or you got chronic pain. So what does chronic pain mean is clinically we put somebody who has pain lasting more than 3 months. In reality, it's usually a mix of some structural issues and some sort of nociplastic component. So the treatment has to match not just physical, but also mental, emotional, and lifestyle. This is what we call a biopsychosocial approach. If you're still watching this, congratulations, you're halfway from becoming a physio.